COVID causes mayhem in China once again. The Wuhan virus shatters the China dream. Crematoriums are flooded, doctors are collapsing due to exhaustion, patients being given CPR on floor, and 1 million deaths have been predicted. As the world raises alarm on the worrying situation, why isn't India paranoid about China's COVID outbreak? Is India ready for the next expected outbreak? And how did democratic India handle the pandemic better than autocratic China in 2020?
National security, international matters of importance. No more.
Just the point.
When COVID-19 originated from China's Wuhan in late 2019 and rocked the world by early 2020, the outbreak became a global nightmare. And now, the Xi Jinping government is once again facing what looks like the world's largest COVID surge of the pandemic. China's public health officials say that possibly 800 million people could be infected with the coronavirus over the next few months. And several models predict that 500,000 people could die, possibly more.
WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country.
China was a virtual prison with rigid COVID restrictions for 3 years till October 2022, despite its adverse impact on the country's economy. 2 months later, and after massive protests, government made a turnaround on its zero COVID policy and abruptly lifted restrictions. As a result, China is facing overburdened hospitals and crematoriums, forecast of millions being infected and millions succumbing to the infection. This has raised fears that the country might see over 1 million fatalities in the coming months. The change in China's COVID strategy was brought on by its own population that hit the streets in November against the incessant lockdowns. And now, this specific event might turn out to be the most significant crisis of 2022.
我们坚持统筹兼顾、合作共赢，率先在全球复工复产，积极推动高水平开放，通过快捷通道、优化签证政策、有序增加国际航班、简化远端防控措施等安排，便利人员往来。
China has nearly 1.4 billion people, and most of whom are susceptible to infection. The rapid spread of COVID-19 could mean large number of people falling sick at the same time. Yet Chinese media has barely touched upon the growing COVID-19 wave. On the contrary, Chinese mouthpiece Global Times has called the alarms raised as fear-mongering. China's official COVID-19 case count has become detached from reality, with the government data showing that new cases continue to decline in the week after it lifted restrictions. As global health experts are watching anxiously at Beijing's COVID-19 surge and Xi's China is paranoid about the virus, is Modi's India ready to tackle the crisis once again? For 3 years, the Chinese government has used strict lockdowns, centralized quarantines, mass testing, and rigorous contact tracing to curb the spread of the virus. Whereas, despite limited resources and with such a large population, India has fought the COVID-19 pandemic in the best possible manner among all countries.
India has always seen humanity as one family. India's pharmaceutical industry has produced cost-effective diagnostic kits, drugs, medical devices, and PPE kits. These are providing affordable options to many developing countries. And we have shared medicines and medical supplies with over 150 countries. 2 indigenously developed vaccines have received emergency use authorization in India, including the world's first DNA-based vaccine.
When vaccination began, there was great skepticism in the international community and media for Chinese vaccines, with barely any discussion on their efficacy, which clearly remains questionable even today. China has always claimed that its vaccines are among the first to use and was the answer to the deadly virus. However, it was not only the Chinese who got scammed by Xi Jinping. The ineffective vaccines were also sent to various other countries as a part of diplomacy by expansionist China. In Xi Jinping's China, the draconian authorities handled the coronavirus pandemic by centralizing control and locking down vast swaths of the country. India too had lockdowns, but cities and towns were not turned into prisons. The Indian government was transparent in communicating with its people about the infectious nature of the epidemic, making the wearing of masks in public places the norm, advising social distancing, turning hospitals into COVID wards and hotels and guest houses into isolation facilities, and setting up field hospitals accommodating lakhs of patients. Simultaneously, as a large section of the world, majorly the West, stockpiled vaccines, India, reputed to be the pharmacy of the world, got its scientists to work on vaccines, and within months, 2 production centers, Serum Institute of India and Bharat Biotech, produced 2 vaccines separately. As much as 94% of the population has received at least 1 jab of the vaccine, and 86% have been fully vaccinated.
I would say our reputation as the pharmacy of the world also has grown. Openness, to looking at Indian produce made in India or produced by Indian company medicines has grown. There are islands in the Caribbean, in Pacific, in parts of Africa, where actually vaccines were made much closer to them. But they didn't get the vaccines from those centers. They actually got it from us. And we saw also the difficult side of the world. There were countries who stockpiled vaccines at that time, who sometimes had stockpiles which were multiple size of their population.
India's approach of depending on its scientists to fight COVID has been widely recognized and appreciated, as well as its helping poorer countries, both in the neighborhood and elsewhere in the world, has been lauded by international organizations. The question remains, how will China deal with this pandemic situation this time? And the only concern that remains is that China doesn't repeat its mistake it did in 2019.